Tell us about yourself, Dr. Painter.
Well, I'm a Georgia native. I was born in Demorest, Georgia, raised in Dalton, Georgia. I went to Emory undergrad and then have lived in the tri-state area, North Carolina, South Carolina, and came back to Hall County in 91. I've lived here in Hall County since 1991, raised our family here. I've got a grandchild and one on the way.
Tell us a little bit more about your experience in medicine.
Well, I've had a wide range of experience in emergency medicine, spanning 33 years. I worked in volumes of 100,000 plus emergency departments down to 10,000 volume. Most of my career was spent at Gwinnett Medical Center. Currently, I do emergency medicine for contract groups in various situations when they're short-staffed, and I'm attending at the Greenville Hospital System right now. So looking at other specialties from emergency medicine, I have a unique perspective. I see changes not only in emergency medicine, but can appreciate changes in other specialties because I deal with each specialty on a daily basis.
Dr. Painter, tell us about the changes you have seen in healthcare.
Healthcare has changed tremendously, as everyone knows. To give a perspective as to how and why it happened, we have to go all the way back to 1940s when AAPS, an organization split off from the AMA. They recognized that third-party payers were coming between the patient and the physicians. Physicians used to charge you based on their time, much like lawyers or CPAs. But after the third-party payers got involved and had to somehow codify and quantify what they're paying for, it changed medicine. Healthcare, as I can appreciate, and I'm sure everyone else can, has become more of a numbers game. The time you get to spend with your doctor is getting less and less. Now, to be fair to the medical professionals, their payers are not the patient any longer. And what's happened is those outside entities have started putting pressure not only in how you're going to see the patients, but how many and where. And this is translated into the rapid push-through of patients in an office practice. The doctor has to, because he can't pay his staff and meet his overhead unless he sees a certain number of patients. This has come about because of third-party payers. This has been an ongoing problem since 1946. The public's going to have to become much more savvy in their medical shopping. They're going to have to look at who is providing their care. And what I mean by that is the doctor employed by the hospital, employed by a large group, or is independent? Because if the doctor is laboring under these CPT codes, for him to stay financially viable, he is going to have to limit the amount of time that he spends with you, even more than he has in the past. And this is not something that he relishes, okay? And I think I speak for all physicians. They want to do the right thing. But they are in a bind. The physicians who have sold their practices out to hospitals are told, gee, let us take care of the paperwork and you can practice medicine. Well, that sounds good, but, and I back this up with a recent study by Jackson and Coker, who were surveying the healthcare providers who have sold out, that indeed they did lower their administrative burden. But the practice of medicine, even though they were told they would get to practice medicine, and physicians take that to mean we do what we think is right, is being limited by the entities that they sold out to. Because the entities have a financial interest in how much time that you're spending with the patient, because that impacts the bottom line. They're very interested in what kind of diagnostic code you put to it. So if you're not coding correctly, or they're going to want certain things done so they can bill for the codes, and the physician is not practicing medicine any longer. He's following orders, basically being told how to practice medicine. And that is now bubbling to the surface, and physicians are being made aware that, gee, once you sell out to these entities, you may not get to practice medicine the way you see fit.
Dr. Painter, what is DPS?
It's executive concierge medicine. and that's exclusive personalized health care provided on a membership basis. DPS is going to be conducted much like an old general practitioner's office. What that means for those people who are young and don't remember those days is that you went to one physician who then coordinated your care with other physicians. If you need a specialist, I will refer you to that specialist. But that specialist will also let me know what's going on, and I will keep you informed, and we will make judgments together based on what that specialist recommends. Because sometimes when you get more than one specialist involved, you run into this problem of one specialist wants to do one thing, another specialist wants to do another, and you're caught in the middle. You need, for the lack of a better term, an umpire or referee who can make recommendations for you in this situation. We're going to offer a little bit of a unique change here. Instead of coming to my office, I'll be coming to you most of the time. The idea behind this executive concierge practice is that I save you not only money, but hopefully time. And I understand business people today don't have the luxury of coming and sitting in an office for an hour, 2 hours, even 3 hours at a time. So we'll try to alleviate that if at all possible.
Dr. Painter, you say that you will save me money as well as time. I see how I could be saving time by having a house call or an office call, but how do you save me money?
Well, time is money. Also, because we're not going to be using third-party payers, insurance, I'm no longer going to have that kind of overhead. My prices will be based on cash. And when I say cash, such as credit card, check, or HSA, or faith-based reimbursement programs.
Do I still need to keep my insurance?
I would keep your insurance for catastrophic events. However, I would raise your deductible. And the savings on that insurance monies I would divert into DPS for the quality, convenient health care you desire. The idea is direct care. You won't be talking to a secretary unless I'm already on a call. Most of the time you're going to get me. And just like you're going to say, Dr. Painter, I got a sore throat. I've got an opening between 9 and 10. Is that convenient? If it works for me, it works for you, I'll be there.
DPS sounds like an exciting solution to some of these issues in healthcare, and it really gives me a lot of confidence in what I can look for in the future working with you. Where can I or someone out in the public go to find more information regarding the DPS program?
Well, you can call us at 770-530-3342 or go to our website, dpsga.com, or send us an email at dpservices@protonmail.com. Thank you for taking the time to watch this video. We look forward to talking with you.